Uh, in the undergraduate program in Communication Science and Disorders here is a pre-professional program. This is a program that prepares people at the undergraduate level for graduate work in speech-language pathology or audiology. We do the foundations in different kinds of sciences. So in the understanding of language development and all that means in terms of semantic syntax, phonology. So all that development that happens in children. There's also learning about the structures, the anatomy, the physiology for the speech production mechanism and for the hearing mechanism. And then there's also the physiology that goes along with how these structures work. And then also there's the acoustics. So we talked about kind of what's in the sender, what's in the receiver. The acoustics is what's going on in the airwaves in between. So what is it that the ear is detecting? So an understanding of what that means for speech and how we can use that to infer what's happening inside, so to have a sense of what people are doing when they make mistakes. Also, there's learning how to listen and write, the oral rehabilitation. What do we do with people who have a hearing impairment or hearing loss? So what's done in those cases? As opposed to hearing aids, cochlear implants, sign language, a variety of ways of talking about training or retraining people. Then there's also a course on developmental disorders. These would be ones that happen in children, including autism spectrum disorders, cerebral palsy type issues, developmental stuttering, articulation or pronunciation errors, language problems that are specific to language as opposed to like the autism spectrum, things that are a little bigger than that. Literacy issues are based in language, so they're also under what we cover. So people with spelling issues and reading issues. Then there's an acquired disorders class also. What can happen later in life? Someone has a stroke. They may end up with something called aphasia, where they lose language skills. They could end up with something called dysarthria, where they lose speaking skills through muscle weakness. Parkinson's disease, things like that can happen. Dementias. Starting in the fall semester of their junior year, the students are expected to be coming to the L.L. Shandell Clinic and observing therapy. So this isn't just an academic in the classroom program, but they're supposed to be doing observations.